Welcome friends. We are revising homeopathic remedy magnesia phosphorica and this is part 7 current clinical correlation and the text is taken up from Allen's keynote and we are trying to sentence by sentence explain in terms of their applied aspect in day-to-day clinical practice. This is a very good study for BHMS students and interns as well as house physician and practitioners at large. So I am Dr. V.K. Chauhan, homeopathic physician. So friends, we are going to take up the first PQR. It tells us that is best adapted to thin emaciated persons of highly nervous organization, dark complexion. So here we have already seen there are two components are given about the Mag Phos patient, his physical attributes and his temperament, who is highly nervous. So you can find this can be the character who is a fit candidate for a magnesia phos. And then let us have the insight how the constitution guides us. The constitution tells us about the risk. And what is the risk? It is the diathesis. What such kind of people can develop into. And in the primary preventive measures, you need to prevent the disease onset. If you have this kind of a person who has no disease, but he can develop, he can develop, the high risk features are seen in primary prevention. So our focus is in such healthy individuals stopping problems before it starts by identifying constitutional predispositions. Now, the goal is to prevent the disease from occurring, and the example is you have to tell them to adopt healthy lifestyle where he should gain weight, he should be able to relax with pranayam and other day-to-day daily activities. Then we point to the secondary prevention. If at all such person develops any problem, so what kind of a problem he can develop, we have to keep in mind and we have to keep thinking about if he is a lean, thin and emaciated person, he is losing weight. So what is the idea? To treat promptly. But what is to be treated promptly? You have to identify the high risk, not only behavior, not only occupation, but suppose he is having diabetes mellitus or he is having some sort of a disease where malnutrition is there, he is losing weight, identify it and correct it. And then tertiary prevention is when already he has got certain problems. So here our focus is people with established diseases having to we can understand those particular diseases so we can improve the quality of life and further prevent the complication. So goal is to manage it well and reduce complications of the existing disease. And if at all disease takes place, you have to go for disability limitation. Some of the examples are writer's cramp. Here they can go into the dystonia, so we have to rehabilitate them, readjustment in their occupation. So such is a wide focus we have. Let us continue it further. We already know that PQR1 tells us the general characteristics who need magnesia phosphorica. So promptly you have to understand what is the primary preventive measures. So high risk feature here indicate nervous hypersensitivity and emaciated individuals. Already the constitutional feature are high risk feature, nervous hypersensitivity and emaciation. Such a magnesia phosphorica constitution is high risk to develop emaciated, can be malnutrition as I was telling, can be diabetes mellitus, can be hyperthyroidism, and they are prone to neuromuscular issues, chronic fatigue and spasmodic conditions. So intervention above features prompt us for primary intervention that includes early intervention with magnesia phosphorica, maybe high potency, and proper lifestyle modification and support can prevent further neurological symptoms and further deterioration. Now let us go to the further, and here what we are going to see, we have to evaluate clinically. Each patient needs to be screened clinically whether he is having neurasthenia, a state of chronic mental and physical fatigue, often associated with nervous system depletion, or hypersensitivity and nervous irritability is there. The highly nervous organization suggests a person may be prone to tremors and spasms and malnutrition and wasting diseases. Emaciated person prompt us to think in terms of chronic state of poor nutrition or metabolic dysfunction often associated with chronic illness or even wasting diseases like diabetes. Chronic pain syndromes can be there. Neuralgia, migraines, sciatica can be there. So, friends, with this we can move to the PQR second, or it is a second sentence in Allen's keynote. Affections of right side of body, head, ear, face, chest, ovary, sciatic nerve, and this is a physical general symptom telling us the side affinity of magnesia phosphorica patient. So even if you have a pain, so let us find out what could be the cause of pain. If it is a neurological cause, probably you will have these particular spinal nerve segments which are going to give us the idea where is the pathology and what kind of a pathology you have to further find out through investigation and examination. So C1 to C7, you see what are the areas are supplied by these spinal nerves. From T1 to T12, you will see what are the areas supplied by these nerves, and then L1 to L5, we have something to do with sciatic nerve, appendix, sex organ, uterus, bladder, and knees. And sacrum supplies coccygeal nerves and sacral nerves. There are five sacral nerves and they are going to supply to the buttocks. So friends, uh, uh, these particular things recall in terms of the magnesia phos. It is often referred as the homeopathic aspirin due to its ability to relieve neuralgic pains. And we have headache, then we have right-sided headache, especially you will find migraine. Migraine is a vascular headache. Ear pain, otalgia, especially on the right hand side. Facial neuralgia, please remember trigeminal neuralgia. And then we have in chest, there can be spasmodic or tightness in the chest, often cramping or shooting in nature. And then in ovary, right-sided ovarian pain, especially during menstruation. And in sciatic nerve, right-sided sciatica, with shooting, cramping, and spasmodic pain which may extend down to the leg and great toe also. General modalities of Mag Phos, we remember that they are worse by cold air, cold water, and exposure to draft and night. They are better by warmth, pressure, bending double, and massage. So friends, let us move to the third PQR. It tells about pains. There are every kind of pains are there. Sharp, cutting, stabbing, shooting, stitching, lightning like, intermittent, paroxysmal, and they are unbearable pain. And there can be associated with constricting sensation, cramps in neurological affections of especially hollow viscera like stomach, abdomen. In abdomen we have intestine, in pelvis we have pelvic viscera. So these are the areas which are much more important from the pain point of view. So let us try to analyze the things. Type of pain associated with Mag Phos. We have sharp cutting, stabbing pains. They become suddenly intense that feel like a knife cutting through, shooting and stitching pains. They are felt like electrical shocks or needle pricks. Lightning like pain, similar to belladonna, what we find, the pain comes and goes suddenly, much like a flash of lightning. Similar, what we have been talking about, belladonna has sudden, intense neuralgic pains. Intermittent paroxysmal pain you will find comes in waves, makes it almost unbearable. This can drive the patient to distress or agitation. Rapidly changing pain location, similarly as we see in calcarea, lac caninum and pulsatilla. The pain does not stay in one place, it moves quickly from one area to another area. This shifting nature of pain is similar as we have been talking lac caninum and pulsatilla. So friends, let us further explore type of pain associated with Mag Phos. Next type is the constriction sensation, which is very similar to cactus, iodium and sulfur. There is a feeling of tightness or squeezing. It is a nerve related pain. This symptom can be seen as we know the cactus. It is mostly with the heart, angina, cramping pains in neurologic and conditions of stomach, abdomen and pelvis similar to colophyllum and colocynth, severe muscle cramps or cramps in the stomach, lower abdomen or pelvis. This type of pain is also present in colophyllum, used for menstrual cramps, and colocynth, used for intense abdominal pain that improves with pressure. In summary, we find the pain nature is sudden, shooting, electric like, cutting, stabbing, or cramping. Pattern comes and goes suddenly in paroxysm and it shifts the location. And worse by cold touch, movement and night, and better by warmth, pressure, and bending double, especially in abdominal cramps. So, friends, let us go to the PQR4. There is a great dread of cold air, of uncovering, of touching affected part, of cold bathing, washing or moving. So it is a modality. Points to sensitivity to cold and movement. They are the key aspect of this symptom and they include great dread of cold air, cannot tolerate cold air and it aggravates the pain. Exposure to cold air triggers neuralgic pain, muscle cramps, or spasms. There is a great dread of uncovering. Keeping warm is essential for Mag Phos patient, which ameliorates the pain. So, covering up is going to give us warmth and which is going to ameliorate the pain or will prevent the pain from occurring. There is great dread of touching the affected part. The painful part is extremely sensitive to touch. Pains and cramps are worse if the affected part is touched or pressed even too lightly. However, firm pressure or massage often relieves the pain. This is the key characteristic of Mag Phos. Then we find great dread of cold bathing or washing. Cold water application aggravates pain and discomfort. Worse after washing with cold water, bathing in cold water, or exposure to dampness. And there is a great dread of moving. Movement can aggravate the muscle cramps and nerve pain. The patient prefers to stay still as any sudden movement can intensify the pain. So, the summary or key takeaway features are Mag Phos is worse from cold, touch, uncovering, and movement. It is better by warmth, pressure, and rest. So characteristic pains, we have to remember neuralgic cramping and intermittent pains are there. We go to the PQR5. It tells us about languid, tired, exhausted, unable to sit up. It points to general weakness and exhaustion. It is the key aspect of this symptom and which we would like to explore. Languid, lack of energy. The patient feels weak, sluggish, and lacking vitality. Even a small task is exhausting. This weakness is often associated with nerve pain, spasm, or menstrual cramps. Tired and exhausted, there is a deep fatigue, as if the body has no strength left. This can be seen in individuals suffering from prolonged pain, muscle cramps that drain their energy, unable to sit up. Extreme physical weakness makes it difficult to sit up, and it may be due to severe cramps, neuralgic pains, or exhaustion from excessive suffering. The patient prefers to lie down and stay warm, as sitting up requires effort they cannot muster. The causes and conditions is neuralgic pain is severe nerve-related pains, menstrual cramps like we see in dysmenorrhea leading to exhaustion. In sciatica, we find muscle cramps causing tiredness and weakness, and general weakness from prolonged suffering or pain. We conclude that the Mag Phos is a great remedy for nerve-related weakness, exhaustion, and pain relief. We find PQR6, complaints from standing in cold water or working in cold clay. So here it is the elements from exposure to cold, and it points complaints from standing in cold. Exposure to cold and dampness can trigger or worsen the ailments in individuals needing Mag Phos. Detail can be taken as of number one, effect of cold and dampness. Cold water and damp environment can cause nerve pain, cramps, and stiffness in body. Muscle and nerves become more sensitive to cold exposure, leading to pain and spasm. Symptoms may arise after standing in cold water or working in wet conditions, such as farmers, gardeners, or workers handling wet clay or mud. The common complaints due to this exposure, they are neuralgic pain, shooting, cramping, and spasmodic. Muscle cramps and spasms, especially in legs or back. You can have sciatica pain, pain along the sciatic nerve, which is worse by cold exposure, and menstrual cramps, triggered or worsened by the cold. Then we have rheumatic stiffness in joints and muscles. We come to PQR7, elements of teeth in children. Spasm during dentition, no fever. With fever, please remember it is belladonna. So, the key symptom in teething babies that includes cramps and spasms. During dentition, babies may experience muscle spasm, twitching, or colicky pain. But remember, there is no associated fever. This child may be irritable or uncomfortable, but does not have an elevated temperature. Children having nervous irritability, they cry suddenly, become restless, or they are overtly sensitive to external impressions. They are better from warmth and pressure. Symptoms improve after applying warmth or gentle pressure. Mag Phos helps by relieving spasmodic pain, soothing the nerve-related irritation, and it is ideal for fever-free teething problem. So friends, let us go to the PQR8, headache. It begins in occiput and extends over the head like sanguinaria and silesia of schoolgirls. Face is red, flushed from mental emotions, exertion or hard study. Worse 10 to 11 a.m. or 4 to 5 p.m. Better by pressure and external heat. So nature of headache is begins in occiput, back of head, extends over the forehead. It is especially associated with the schoolgirls, and face is flushed. Headache is associated or accompanied by flushed face, indicating that increased blood flow or nervous irritation to the face. It is triggered by emotional stress like anxiety, sadness, anger. Intellectual overwork, too much reading, studying, or thinking. Physical exhaustion after intense effort, physical effort. Aggravation, as we know, is occurs around 10 to 11 a.m., 4 to 5 p.m., and these time-specific aggravations suggest connection to the body's energy cycle, making it similar to the remedies like Netramure, which also has morning headaches. Aggravation is exposure to cold air or draft can worsen the headache, and emulsion is by applying firm pressure to the head and warm application. Next, PQR is 8, headache. Still, we are going to supplement the information. So let us go for a comparison. Symptoms we find location, associated symptom, triggers and relief. For Mag Phos, it is onset, occipit, travels to forehead, and associated symptom is flushed face, spasmodic pain, triggers mental stress and exhaustion, relief by heat and pressure. We have sanguinaria. It is also a right-sided remedy. Begins in the neck, moves to the right eye, and the associated symptom is a burning sensation, nausea, better by vomiting or after vomiting, and trigger is sun exposure or menopause, and relief is by lying down in dark room. And we will compare silesia. Here the pain location starts at the occiput, moves forwards. Associated symptom is sensitive scalp, worse from cold, and trigger is cold draft, suppressed sweating, and relief is by wrapping head warmth. We go to the PQR9, neuralgia of phase, supraorbital or infraorbital, intermittent. And here we find trigeminal nerve is the nerve which is having facial region supplied by, it has got three divisions. Number one, fifth cranial nerve first division is ophthalmic. It supplies to the skin above the orbit, lacrimal gland, supraorbital and supratrochlear nerves, infratrochlear, external nasal nerves. These are the further branches. And we find the second branch of trigeminal is the maxillary nerve. It supplies to the cheeks of skin below the orbit, zygomaticotemporal and zygomaticofacial, infraorbital. These are the branches we have. And then third and biggest branch happens to be the mandibular nerve. It supplies to the jaw, lower jaw, below the angle of mouth, also auriculotemporal muscle, buccal muscles, and mentalis muscle also. Mentalis, sorry, these are the branches. Mentalis muscle and buccal muscle and auriculotemporal muscle will be supplied by facial nerve, because facial nerve is a motor nerve. It is supplied by sensory area is supplied by sensory nerves. So here what we find in trigeminal neuralgia, we have pain in the distribution of supraorbital nerve, which is a branch of ophthalmic division of fifth cranial nerve, and infraorbital nerve, which is a branch of maxillary division of trigeminal nerve. Okay, so let us further try to figure out. Right-sided neuralgia predominantly we will find in Mag Phos. The nature is intermittent darting and cutting. Pain comes and goes with sharp shooting and stabbing, and it is worse by touch, cold, and pressure. Better by external heat, very strong characteristics of Mag Phos. Now we go to the PQR10. We have toothache, night at night, rapidly shifting, worse eating, drinking, especially cold things, better by heat. Now let us go to the symptom proper. Toothache that becomes worse at night, possibly due to the temperature changes or lack of distraction, making it more noticeable. And rapidly shifting pain, the pain moves quickly from one tooth to another, from one side jaw to another, and worsened by the eating, drinking, especially cold things. This suggests a sensitivity to temperature changes, which is commonly seen in neurological conditions. It is relieved by heat. It is a crucial factor in the selection of the Mag Phos. Clinically, We find the patient has got neural sensitivity, especially in the trigeminal nerve distribution, and pulpal sensitivity can be there, likely affecting the tooth pulp of individual tooth. Causes can include cracked, chipped, broken tooth, tooth decay or infection, recent tooth filling, and pressure from clenching or grinding the teeth. Dental sensitivity can be there because generally it occurs due to the loss of enamel or damage to the enamel of the tooth. Now we go to the PQR11, spasms or cramps of the stomach with clean tongue as if band was drawn tightly around the body, and here we find it can range from mild aching to severe stabbing pain. Common causes of stomach cramping include viral infection like norovirus or bacterial infection. Waterborne infections are very common. We have associated fever, stomach cramps, nausea, vomiting, diarrhea, exhaustion can be there. It can also occur because of the food poisoning, eating contaminated food, stomach cramps, nausea, vomiting, diarrhea can be there, and food sensitivities. There are certain foods which are not being tolerated, gluten, lactose, alcohol, and here if the patient takes, they have cramps, nausea, heartburn, diarrhea, and excessive gas. Irritable bowel syndrome is one of the very important conditions which majority of the patient, every third patient coming to you with the GIT disturbance will be having IBS. Patient has got diarrhea predominant or constipation predominant, but the stools more than 3 times a day is a rule. Anxiety, stomach cramp can occur, and if the pain is because of anxiety, like in school going children, you will find if you examine, pulse will be the fast, breathing is the fast, constipation or diarrhea, and history of stress can be illustrated. Other causes include diverticulitis, inflammatory bowel disease, Crohn's or ulcerative colitis, but you can prescribe such conditions, but it is a quite a advanced diseases which needs a proper diagnostics. Now we go to the PQR12, colic, flatulent, forcing patient to bend double. Now we can see a child who is having colic and you will see the symptoms like difficult to comfort, excessive crying, high pitched piercing sound, clenched fist, excessive gas, knees drawn up toward the chest and face is red, and grimacing, frowning. These are the general features you will encounter on general examination. The type of pain is colic, which is spasmodic, cramping, gripping. Onset is sudden and violent. Common cause due to gas, flatulence, spasm, or intestinal irritation. Better by bending double. Pain is so severe that the person curls up and presses the abdomen for relief. Better by heat. Clinical extended information includes causes of colic. GIT causes are IBS, irritable bowel syndrome. I am not talking about inflammatory bowel diseases. So, food poisoning, peptic ulcer disease, GERD, lactose intolerance, celiac disease, inflammatory bowel disease can be Crohn's or ulcerative colitis. Intestinal obstruction, appendicitis, hernias, strangulated valvular or interception needs to be kept in mind. Gynecological conditions include dysmenorrhea, endometriosis, ovarian cyst, pelvic inflammatory disease, and rarely you may come across ectopic pregnancy also. Urological causes can be kidney stone, urinary tract infection, and cystitis, where you will have bladder spasm. Hepatobiliary causes are cholelithiasis, cholecystitis, pancreatitis, and hepatitis. So, friends, let us go to the PQR13. Menses early, flow dark, stingy pains, worse before, better by flow, better when the flow begins, and pains darting like lightning, like shooting, worse right side, better heat, and bending double. So, this is a menstrual colic, and what we are going to see here is menses early. It means there is polymenorrhea. flow dark and stingy. This tells us about the appearance of the color and nature of the discharge. Pains worse before the flow, better when flow begins. It is a key indication for magnesia phos and can be compared with lachesis and zincum. Pains darting like lightning shooting. The pain sensations are like this. Worse on the right side, predominantly affecting the right side of the body, better by heat and bending double. It is often compared with colocin. This is also a pain relief medicine where bending double gives relief, but Mag Phos is more suited to sharp shooting type of pains. So let us try to figure out uh, much important thing. What we are going to talk about is the painful menstruation. Cause is no underlying cause. 52 general information about we are having the overview of dysmenorrhea. So let us have the background information. The definition of dysmenorrhea is painful menstruation, causes no underlying cause. Generally, incidence is 50 to 90% female of reproductive age group. Symptoms that is onset within a year of first menstrual period and then pain is during first few days of menstruation. It can be associated with diarrhea, nausea, duration less than 5 days. Usually when we talk about primary dysmenorrhea, and diagnosis is by mostly ultrasound is going to help us out. Differential diagnosis is ectopic pregnancy, pelvic inflammatory disease, interstitial cystitis, and chronic pelvic pain. Prognosis, it often improves with the age. Treatment is general. Heating pad and medication can be given. Pharmacological, we have homeopathic belladonna, colocin, colophyllum. Conventional medication is non-steroid anti-inflammatory drugs are given, but you should remember if somebody is getting these drugs, what kind of adverse drug reactions the patient may have. So type of dysmenorrhea, we have two types of dysmenorrhea. Common primary dysmenorrhea is very common and it is a very normal kind of a thing. It is caused by the neural uterine contraction. Natural uterine contraction due to the high prostaglandin concentration aimed at shedding its lining. And secondary dysmenorrhea is indicates reproductive tract diseases. Causes can include uterine fibroid, endometriosis, pelvic inflammatory disease. Clinical features, you will find differentiating features primary and secondary dysmenorrhea. Onset primary dysmenorrhea is the first day of period and secondary dysmenorrhea is 1 to 2 days before the period. Duration is 8 to 72 hours and secondary dysmenorrhea is less than 3 days. Location is lower abdomen, radiates to lower back and legs. Prognosis, the primary dysmenorrhea often improves with the age and secondary dysmenorrhea it worsens with the age. Now we go to further exploration of the symptoms. There is in PQR 13 there is the last line vaginismus. So what is vaginismus? It is an involuntary spasm of vaginal muscles causing pain and difficulty with penetration. Magnesia phos is indicated when there is a violent spasmodic contraction of the vaginal muscles. The pain is cramping, sharp, and shooting in nature. The condition is relieved by warmth and pressure. It may be associated with nerve hypersensitivity or dysmenorrhea, painful menstruation, you can call it. This remedy is often suited for females who experience nervous tension, hysteria, or oversensitivity along with spasmodic pain. So, friends, let us further explore vaginismus. An overview. Vaginismus is a type of sexual dysfunction and it is characterized by involuntary and persistent contraction of the vaginal muscles when vaginal penetration is attempted. The contraction can prevent sexual intercourse and make it very painful. Vaginismus doesn't interfere with sexual arousal, but it can prevent penetration. The common causes include stress is a common cause. Other causes they are sexual trauma or psychological issues. Clinical presentation is as the partner attempts penetration when a woman inserts tampon. When a woman is touched near the vaginal area, she develops severe pain. On gentle physical examination, no physical abnormalities are found. Types of vaginismus can be primary vaginismus when vaginal penetration has never been achieved. Secondary vaginismus is when vaginal penetration was once achieved but is no longer possible, potentially due to the factors such as gynecological surgery, trauma, or radiation. Some women develop vaginismus after menopause, and the cause could be the estrogen level, which drops after menopause. A lack of vaginal lubrication and elasticity makes intercourse painful, stressful, and impossible. It can lead to vaginismus in some females. So let us see the degree of vaginismus, Lemont and Placid. So first degree is when the reassurance is given, the patient finds that pain is elevated. There is no pain. And second stage is even with assurance and support, spasm remains throughout the pelvis. And third stage is there is a marked levator spasm and elevation of the buttocks. And fourth stage of vaginismus is levator spasm and adduction of the pelvic muscles. And fifth grade of vaginismus is due to high adrenaline output. Anxiety causes high adrenaline output. Visceral reaction include, apart from visceral reaction, we find there is a emotional reaction include sobbing, screaming, palpitation, trembling, nausea, vomiting. Now we go to the PQR14, enuresis nocturnal. From nervous irritation, urine is pale, copious after catheterization. So nocturnal enuresis is bedwetting, usually seen in night time. The condition is involuntary passage of urine occurring during sleep rather than when awake. It is from nervous irritation. The enuresis is linked to nervous system disturbances, possibly caused by hypersensitivity, stress, rather than a structural defect in the urinary system. Urine is pale and copious. The urine is light colored and it is produced in large quantities. So you have to keep in mind other conditions which can cause like dipsomania or frequent drinking of water, or patient is having some sort of anxiety, or he may be suffering diabetes insipidus and diabetes mellitus also. After catheterization, the issue may arise following catheterization, which suggests irritation or overstimulation of the urinary tract, especially urethra, leading to temporary loss of bladder control. Now let us have the overview of enuresis nocturna. It is an involuntary urination during sleep in children's plus minus 5 years of age of children. It is a developmental age when the bladder control is expected. They should achieve the bladder control by this time. Type primary, child never achieved dry nights, and secondary is child had achieved dry nights but he resumes bedwetting. The causes include genetic factors like family history. You have nocturnal enuresis in parents, then it increases the risk. Delayed bladder maturation, excessive nighttime urine production, or deep sleep And deep sleep is such that there is a failure to awaken to the bladder signals. Another condition which is very, very important is psychological factors. Stress, anxiety is common in secondary enuresis. Medical conditions can also contribute, like urinary tract infection, diabetes mellitus, constipation, sleep apnea, neurological disturbances. Symptoms generally in primary symptoms: recurrent bedwetting, night more than 2 to 3 times, 3 times a month. Associated symptoms, if pathological causes are there: daytime incontinence, urgency, dysuria, suggest UTI, polyuria, polydipsia in cases of diabetes, snoring sleep, especially in related to sleep apnea. And on history, you will find pattern: primary or secondary fluid intake, stressors, family history. These are the areas which needs to be explored. Rule out daytime symptoms like urgency and frequency. Physical examination: abdomen, you may find constipation; spine, there may be spina bifida or some other defect, or genitourinary anomalies can be present. Investigation includes urinalysis, rule out UTI, DM, or renal issues. So investigations, again ultrasound if there is any structural abnormality is suspected, and you have to see the post-vital residual urine. Voiding diary needs to be maintained. Track daytime voiding patterns. Treatment includes behavioral interference or interventions like motivational therapy. Reward symptoms. If there is a dry nights, reward the child. Bladder training scheduled, voiding, double voiding before bed. Fluid restriction: reduce fluid intake 2 hours before the bedtime. Bedwetting alarms: conditioned respond to awaken when the wetting occurs. This is highly successful method of treatment. Homeopathic repertory references you will find in Kent repertory. We have Kent repertory: bladder, urination, night incontinence in bed. So many drugs are there. You can see first grade, second grade, and third grade remedies. The prognosis is spontaneous. Resolution is common in 15% per year cases. Now let us go to the PQR-15, cramps of extremities. During pregnancy of waiters, piano or violin players, we find cramps of extremities. Mag Phos is known for the relieving spasmodic cramps affecting the arms, legs and hands. These cramps are often sudden, sharp, relieved by warmth and pressure. Cramps during pregnancy in pregnant females may experience severe muscle cramps, particularly in legs, due to the mineral imbalance, nerve irritation, or pressure from the growing uterus. Mag Phos helps reducing these spasmodic pains, particularly when it is better from warmth and rubbing. Cramps in waiters, writers, pianist, and violinist. This indicates occupational cramps or repetitive strain cramps that occur due to the overuse of specific muscles. It is specifically useful for writers, musicians, or anyone performing repetitive, fine motor movements leading to fatigue and cramping of the fingers, hands, and forearms. So let us have the overview of cramps in extremities. The common causes are electrical imbalance, deficiency of magnesium, potassium, or calcium. Nerve compression like sciatica can contribute. Overuse and fatigue, prolonged use of muscles without rest, as in occupational conditions, pianists, musicians. Poor circulation, peripheral artery diseases can cause intermittent claudication and predispose for cramps. Medical conditions include diabetes and thyroid disorder, hypothyroid or hyperthyroid. Sign and symptoms include sudden sharp muscle pain. There is a tightening or hardening of the muscle, cramping in the arms, legs, or hands, temporary loss of muscle control, and relief by warmth or pressure. What investigation we can carry out is the blood test for electrolyte imbalance. KFT and vitamin deficiencies are also important. Nerve conduction studies to evaluate the nerve function and electromyography to assess the muscle activity. Doppler ultrasound can help us to check the blood circulation, how the blood vessels are there, and treatment protocol includes immediate relief, apply warmth or massage or relax the muscle. Gentle stretching of affected muscle will help. Hydration with electrolyte rich fluids is good. Medication can be like magnesia phos, 6x potency, and lifestyle modification includes regular exercise to improve the muscle function, diet rich in magnesium, calcium, and potassium, hydration to maintain the electrical balance, avoid prolonged inactivity or overuse of the muscle. So, friends, occupational cramps in writers, pianist, and violinist. Let us go for this occupational cramp overview. The definition is occupational cramps, also known as focal dystonia or repetitive strain cramps, are involuntary, painful muscle contraction that result from excessive or repetitive use of specific muscles, commonly seen in individuals who perform fine motor tasks for extended periods. The common cause is repetitive muscle overuse. Constant hand or finger movements lead to fatigue and strain. Poor ergonomics, incorrect posture, awkward hand position, or excessive tension. Nerve compression can also be the cause. Pressure on the nerves, like carpal tunnel syndrome, may trigger the cramps. Magnesium or electrolyte deficiency, lack of essential minerals, which can affect the nerve function. So, stress and anxiety also contributes. Underlying neurological conditions can be like dystonia or nerve dysfunction in some cases. The sign and symptoms of occupational cramps is sudden painful muscle contractions in fingers, hands or forearm, involuntary hand movements, fingers curling or freezing in place, difficulty in grasping the object like pen, instrument or keyboard, stiffness and weakness in unaffected muscles, increased symptoms during activity but relief when resting. So here we find cramp in writers, cramps in violinists, immediate relief, how we can provide immediate relief, rest and relaxation. Take frequent breaks to avoid prolonged strain, stretching and massage, gently stretch fingers and hands, apply warm compressions. Heat therapy relaxes the spasm in the muscle. Medical and physiotherapy approaches include magnesia phos is one of the very important homeopathic remedies. We have ergometric adjustment, use proper hand posture and wrist support. Physiotherapy and strength training helps by exercising to improve the muscle flexibility and endurance. Botulism toxin injections in severe cases can reduce the muscle spasm in chronic dystonia. Preventive measures include hydration and proper nutrition, regular hand and finger exercises, and stress management is very important, like deep breathing and relaxation exercises. So, friends, thank you very much for watching and patient listening. Sharing is caring.